Hello, everyone, and welcome to today's webinar, Best Practices for DOT Background Screening and Drug Testing Programs and Policies. I'll be your host today. I'm Jeff Ernst, Vice President of Sales and Marketing here at Orange Tree Employment Screening, and we are delighted to have Bill Current, the President and Founder of Current Consulting Group. He will be our keynote speaker, taking us through our content here in a few minutes. Just a couple of things as we begin today's webinar. One, as a reminder, we are offering continuing education credits for SHRM for participation in today's webinar. If you look at the handout, which is as part of the platform, and you download it, there's information on how to request credit for today's webinar, so please be aware of that. The call is being recorded. We will be taking questions throughout, so all you have to do is type a question into the panel, and if it's appropriate to answer that question during the course of the meeting, we will. If it's better served for kind of a Q&A at the end, which Bill has reserved some time, we will handle at that point. If we do run out of time, I promise you that we'll get an answer to your question that you submit for us. And there's just a reminder, there is a handout that you can download and also kind of follow along with us today. So this is I suppose my last item of house cleaning, that the material discussed during this webinar is not legal advice and should not be construed as such. So a little bit about Orange Tree before we get into Bill's presentation. We're in business quite simply, yet very importantly. We believe every company deserves a background screening program designed solely for their best interests. So it's about you, it's not about us and our goals. It's all about whatever you need and however we can help you accomplish those goals. Our value proposition to you is pretty straightforward, and it's all about when you choose Orange Tree, you don't have to compromise. There aren't any surprises in the business relationship, and ultimately our goal is that you would acknowledge that there's no regrets as we partner with you and become a teammate as we develop alongside you your programs of interest. From a no compromise perspective, in addition to being a full service provider, you need technology, you need compliance, and you need customer service. We do well across each of those pillars. In terms of being transparent and visible to you, we make our terms very clear, very easy to understand. We define our scope, go out of our way to make sure that you understand that, and we publish our fees before you start a relationship with us, because we just don't want to have any financial surprises on the back end. And as Jessica Brandt, one of our many DOT-based clients in the Orange Tree portfolio, it would acknowledge is that not only are we a teammate and trusted partner for the things that I already mentioned, but we go out of our way to do the hard work for them, which makes things easy for her and her team. So just a brief explanation here in terms of the chart. We are a full service provider in the background screening drug testing business, and we offer not only national but also international services across these different areas. One of the things that differentiates Orange Tree is the fact that years ago we invested in a technology platform and a technology team. And so what that means for you is that we deliver speed to the market. You can get more done faster, whether that's an ATS integration, which today our existing integrations cover more than 75% of the market share in the market. And if there's one out there that we don't have an integration, we can build that if it makes sense for us to do that in conjunction with you. We also have amazing mobile-friendly, optimized technology for the best candidate experience on the market, and ultimately all the information that you need to be aware of as you go about your business, administering the background check process, bringing people on board, is available to you at your fingertips through our portal or in your ATS. What this results in is the fastest turnaround time on the market and the ability for Orange Tree. We process per capita more than 130,000 searches per employee, and the significance there is we have room for growth, and it truly is something that I believe sets us apart in our capability to deliver results to you. On the back end of that, We also have a lot of technology at your disposal serving your needs, again, all focused on turnaround time, accuracy, and ultimately enabling customer service to you. So as you need information, you need answers, we're able to deliver that. And quite frequently, it's a technology automation that is at your disposal, whether you see it directly or not. Briefly on our Candidate Connect, that is our mobile platform for your candidates. As you can see, the screen, it's an actual screen on the left-hand side. It's kind of the pizza tracker, very easy for today's candidate to know where they are in the background screen process. And if they know what's going on, you also, of course, know what's going on. It's been highly rated by our candidates, decreases turnaround time, half a day up to a day, depends on the client experience, and provides your candidate as well as yourself real-time tracking and ETA information. And then relative to today's discussion, where we're going to talk about background screening and drug testing, we do have a single order platform that is administered via our Candidate Connect tool. So before we go to Bill, I do have a question, if that's all right. I am curious to know, given maybe I thought I was going to launch a poll here. Let's try this again. So I am interested in your all's input. It doesn't seem that long ago where we had low unemployment and it was difficult to find candidates and fill open positions. And now it's a different environment, but I'm curious if you all would answer this question and give us a point of view on what is it like today filling open positions. So I'll keep it open just a few more seconds. I do want to get to Bill's content, but I am very interested to know what it's like for you. Okay, we have more than half of you who have voted. And let's see if I can share this information with you. Yeah, I don't think I'm surprised by that. And thank you for that information. This kind of helps us ensure that we're focused on your needs and getting things done for you in the best way that we possibly can. So with that, Bill Current, President and founder of Current Consulting Group, will take us from here. Bill he's a 30-year veteran of the drug test industry. He and his organization for a number of years, over 2 decades now, have been running a industry survey on drug testing compliance and other information in that subject matter. Wildly popular, a must read and must have for all of you. Bill is also an author of 10 books and possibly more, Bill. I probably have to update my charts on that. So with that, I am going to change presenters to Bill, and Bill, the floor is yours at this point. Thank you very much for joining us today.
Well, thank you very much, Jeff. Let me just get my screen up here for the audience. Let's see here. Okay. And then that over. Are you seeing my screen now?
You know, I see it in a windowed mode versus full presentation.
It should be it's showing on my screen in full presentation.
Okay.
Let me see what's going on with that. So you're seeing the PowerPoint slides, maybe?
Yes.
Okay, so let me stop showing my screen and let me try it again. Okay, that should work. How are we doing?
All right.
Perfect.
Thank you.
Well, thank you again, Jeff, and welcome everyone to today's presentation. As Jeff mentioned, we're going to talk about best practices for DOT background screening and drug testing programs and policies. And I'm going to sprinkle in some updates from the Department of Transportation from the various modes, given the sort of ongoing COVID-19 pandemic and some of the alterations and waivers that DOT has issued. But I encourage you to ask me any questions that you have, anything related to drug testing or how the pandemic is affecting drug testing. Please feel free to submit those questions. We'll leave time at the end for that. Jeff mentioned that we do surveys here at the Current Consulting Group, and we do 2 every year. The industry survey, meaning the survey of drug testing providers, and then we do an employer survey and get the other perspective on drug testing trends. This year, however, we also added a 3rd survey, which is the COVID in the workplace survey. We just completed that. We just presented the results yesterday in the first ever webinar on this topic for the sponsor of that particular survey. And so now that I've presented that, I'm free to share the results outside of that venue. So I'll sprinkle in some of those results as well. I did think it was interesting, though, in Jeff's poll that he just did, and I think the percentage was 48% of you, somewhere in that range, said it was more difficult to hire people right now. The unemployment rate at the end of July, through the month of July, was 10.2%. That's down from 11.6, I think it was the month before. And in the COVID survey that we did, we did 2 different tracks. We did one for providers and one for employers. And the employers indicated that they are having challenges. And so I wasn't surprised to see that number. Now, would we expect that 40-something% that we just saw to be lower or higher? Well, probably 7-8 months ago, it was very low. Very few of you having problems. Maybe the challenge was finding people to hire because the unemployment rate was so low. And now the challenge that you're faced with, and we did a webinar on this with Orange Tree not too long ago, where you've got a significant increase in substance abuse and alcohol misuse taking place during the pandemic. So the old substance abuse levels that the government shared at the end of 2019 are all out the window now, because during the pandemic, as would be the case with any sort of ongoing national crisis, substance abuse levels have gone up. And of course, we saw unemployment go up significantly, but a lot of those people who are now returning to the workplace, and thank heavens that in many cases they are, unfortunately, they're coming with an increased percentage of them having been using drugs at an increased level during the pandemic. So, and this affects a lot of different things, such as DOT required drug testing. So we're going to go into those issues right now because the Department of Transportation drug and alcohol testing regulations, the entire intent is to create safety or to secure the safety of the transportation industry. And so some of that is directly affected by the increase in substance abuse during the pandemic. So this is the agenda that will follow. Now, let me say at the outset, though, there's a whole area of DOT regulations that we won't cover in this webinar, and that's the clearinghouse requirements. That's an entire webinar and a complicated webinar at that. If you have questions about it, I'll attempt to answer them at the end, but we won't touch on that in any great detail during this presentation. Let me start out by saying, though, that I believe because of the circumstances that I just described, that now is not a good time to curtail or stop drug testing, generally speaking. The federal government continues to require drug testing. DOT continues to require drug testing. There have been some modifications, some waivers issued. I'm going to talk about those today, but the drug and alcohol testing requirements of all the various agencies of the Department of Transportation and the Coast Guard are all still in effect. No state drug testing laws have been suspended. There are some state laws that mandate drug testing under certain circumstances in certain industries. Those have not been suspended. And while it has been somewhat challenging in some cases for sort of traditional lab-based urine testing to occur because of some of the challenges with collection sites, and you can work with your representatives of Orange Tree to sort of solve those problems. But Lab-based urine testing still works. It's still a valid testing method. It's taken a little bit of a hit during the pandemic, as we learned during the COVID survey that we did, as companies have sort of scrambled to try to keep their drug testing programs going, despite some of the challenges in getting urine specimens collected. We're starting to see that settle down a little bit, but it has pushed some companies toward telehealth collection services, toward alternative testing methods that don't require going into a collection site, such as lab-based oral fluid testing or POCT, point of collection devices, etc. So there have been some efforts to work around the obstacles, but the drug testing requirements of the DOT still exist, and employers are not excused from complying with those regulations. But we're going to talk about some specific waivers that have been issued. Now, generally speaking, just as a preamble to the DOT specific information, I just want to reiterate that pre-employment drug testing is legal in every state. And so as employees start to flood the job market, as job seekers are out there knocking on your door, pre-employment drug testing is still legal in every state. There are some states that have legalized marijuana that place some restrictions on pre-employment testing for THC. And THC is, of course, the psychoactive ingredient of marijuana. But even in those states like Illinois and New York and Colorado and others, there are typically carve-outs in those laws that exclude safety-sensitive positions from the restrictions or the prohibitions. That New York City is the only state the only entity that has prohibited testing altogether for THC on a pre-employment exam. But safety-sensitive positions typically excluded from those prohibitions and restrictions. Very important, as people come back into the workplace, pre-employment drug testing for all these other drugs besides marijuana in those pro-marijuana states, that's all still included, including psychotherapeutic drugs like the antidepressants, anti-anxiety medications, etc., which have been part of the increase in substance abuse that we're seeing during the pandemic. So, well, marijuana has been deemed in most states that have legalized it as a quote unquote essential medicine during the pandemic. Much of the abuse is also occurring, or more likely occurring, with the psychotherapeutic drugs, the misuse of prescription substances and controlled substances like that. Cocaine, yes. Heroin, yes, to some extent, but mostly the drugs that people find easier to get their hands on, like the pills and marijuana where it's been legalized. So I don't think pre-employment drug testing is dead. I think it's probably more important than ever right now, in conjunction with background screening, to make sure as you're bringing people back into the workplace, as you're starting to restaff and reopen, that you're ensuring that the people that you bring on are going to be safe and healthy workers. Under the DOT regulations, you test for a 5-drug panel. Now, this looks like a lot more than 5 drugs on the screen, and in reality, it sort of is. The federal government, the Substance Abuse and Mental Health Services Administration, SAMHSA, and DOT like to continue to refer to it as a 5-panel test. But as you can see under opioids, it goes in a lot of different directions. And not that long ago, they added oxycodone, oxymorphone, hydrocodone, and hydromorphone to the list under opioids. Okay, some years ago they added 6-AM, which is 6-amylmorphine, which is a biomarker of heroin. So when you test, if they detect in the laboratory 6-AM, that's a 100% proof that the individual has been using heroin, as opposed to some other type of opioid or some other type of drug. But these are the drugs that are typically included in the DOT panel. Now, I highly recommend, and not just because I'm on an Orange Tree webinar, that companies conduct background screens as well. Now, some companies have a reluctance to do both the drug test or the background screen, but I don't think that you can separate them. There are some things that a drug test can tell you and other things that a background screen can tell you. So we do drug testing to detect drugs, we do background screens to detect a whole bunch of other things. If you have some issue with that, then maybe you do the drug test first, and if the person's negative, you go on to the pre-employment screen. However you want to do it, I don't think that you can really separate the two. Now, as I mentioned before, I'm not going to talk about the clearinghouse regulations under SAMHSA, or under DOT, excuse me. but those are a way in which employers can sort of keep track of past drug use history or drug test result history of candidates for safety sensitive transportation jobs. So maybe we come back at some point and we do a webinar on that because it is important. But all of that has been sort of turned upside down within the federal government because of the pandemic. I'm not saying that they've excused it or they suspended it or they're going to be much more lenient than they would normally be for non-compliance, but everybody is a little bit more understanding of the fact that employers are finding it very difficult to comply with some parts of the regulations. And this is the list of all the DOT agencies that require drug and alcohol testing. Under the Federal Motor Carrier Safety Administration, which you see right there at the top, you also have the clearinghouse requirements. And the FMCSA has issued certain waivers for pre-employment testing on a limited basis. I've got a slide coming up on that. But these are the agencies, and some of you fall into one or more of these categories in terms of requirements that apply to you. It's not unusual to have companies, say in the oil and gas industry, that are regulated under the pipeline, the PHMSA, they're second to the bottom, under the Pipeline and Hazardous Materials Safety Administration guidelines, and also under the Federal Motor Carrier Safety Administration guidelines. And so sometimes we get clients who ask, well, which one do I comply with? And the answer is both. But there is guidance within the regulations if you have to do random testing for one agency and random testing for another. Here's part of what DOT came out with when it became apparent that the pandemic was going to not be a short-term event in the country. So, and let me just read some of this. I normally don't read slides, but let me just read some of this so that I'm not paraphrasing important information. So as a DOT regulated employer, you must comply with applicable DOT training and testing requirements. What that means is that you still have to train your supervisors. You still have to make sure that those requirements are being met, as well as your drug and alcohol testing requirements. However, DOT recognizes that compliance may not be possible in certain areas due to the unavailability of program resources. You should make a reasonable effort to locate the necessary resources. And then they went on to talk about different possible fixes, like mobile collection services. They still do not allow, under the DOT regulations, however, the use of point of collection devices, the single-use instant testing devices. Those are not allowed under the DOT regulations. And right now, excuse me, even though SAMHSA has approved lab-based oral fluid testing, which makes collections easier, under the DOT regulations, they haven't approved it yet. They have said they're in the process of developing regulations for lab-based oral fluid testing that will comply with the SAMHSA guidelines that came out in October of 2019. But they're not there, they're not out yet, and the pandemic has kind of slowed down all of those things as well. It goes on to say, as a collector, as a blood alcohol technician, or breath alcohol technician, excuse me, laboratory, MRO, SAP, you should continue to provide services to DOT regulated employers if it is possible to do so in accordance with state and local mandates related to COVID-19. So they are aware that state governments have issued regulations, guidelines, reopen guidelines, relative specifically to COVID-19. And so what they're saying to providers, you know, good conscientious companies like Orange Tree, is you still have to provide these services, to your DOT covered clients, but we understand that there may be specific guidance at the state level that may apply. And so what they're saying there in the second bullet is follow your company policy, directions from state and local officials, which are in those reopen guidelines, and specifically guidance from the Centers for Disease Control and Prevention, the CDC. You'll also find good information that is very applicable in the workplace right now under the pandemic in the guidelines from the Equal Employment Opportunity Commission, the EEOC. That's the agency, the entity that governs compliance with the Americans with Disabilities Act. A COVID-19 test in the workplace is considered a medical exam. And under normal circumstances, there would be very restrictive guidelines on what to do with medical exams, when you can do them, when you can't do them, what you do with that information. The EEOC has ruled that COVID-19, the pandemic, is a direct threat, quote unquote, a direct threat to the workplace. And so certain restrictions have been suspended or waived for the time being. And so you've got to go to the EEOC website as well to find information about that. DOT is saying, look at those guidelines. Look at the guidance from the CDC in terms of safe workplace practices for your DOT covered workers. In other words, they're not superseding it. They're not saying we come first. They're saying take that into account as well. And the Federal Motor Carrier Safety Administration, which represents the large majority of all DOT drug testing that takes place in the private sector, has issued specific guidance. And so I would refer you specifically to their website, the fmcsa.dot.gov website, where you can find specific information for the FMCSA covered workers and employers. Now, there's been a direct threat, of course, impact in sort of the day-to-day operations of drug testing mandated by DOT as a result of the pandemic. So let me go through some of the agencies, and there's a lot of dense copy on these, but as you go through and watch maybe the recording of this webinar presentation, you'll be able to pause and look at the screen and maybe read it in more detail. I do want to point out a couple of things as we go through each agency. So if you look to the, well, on the left, it's basically saying pre-employment drug testing still required. You have to have a negative result before you can put somebody into a safety sensitive position. If you don't have that result, even if you can't get the drug test done because of the pandemic or something related to the pandemic, you can't put that worker in a safety sensitive position. You're going to see that same language worded a little bit differently, but saying basically the same thing for all the DOT modes. They're all saying the same thing, pre-employment testing. Now you're going to see a little bit of a waiver, some waiver language on Federal Motor Carrier when I get to that. I've saved that for the end, but they're all requiring pre-employment testing still in one way or another. Now switch to the right side of the screen here. Let me read that first bullet. If you are unable to conduct a pre-employment drug test and obtain a negative result in accordance with 14 CFR Part 120.109A, then you are prohibited from hiring or transferring an individual into a safety sensitive position. The same is true if you conduct pre-employment alcohol screening, which not everybody does, but you're authorized to do that under the DOT regulations. The third bullet is crucial here, and this is sort of indicative of what we'll see in the other agencies. If you furlough an employee and remove the employee from the random testing pool, you are permitted under the regulations to conduct a pre-employment drug test of that individual when they come back into the workplace. So a lot of companies have obviously furloughed employees as a result of the pandemic, and they're coming back into the workplace. Maybe they're jumping right to the front of the line for rehiring. And what it's saying here is that if you remove them from the random testing pool during the time that they were furloughed, then you can conduct a pre-employment drug test before they return to performing safety sensitive work. If they remained in a in a random drug testing pool during the time they were furloughed and they were subject to being randomly selected for a drug test, then you wouldn't necessarily have to do the pre-employment test. Now, so think about that for a second. Is an employer required to conduct a pre-employment drug test on a safety sensitive employee who is on an extended leave or furlough? You are allowed to do that. Required to do it though, however, if they were not subject to random testing during their period of being furloughed. Okay, I'm going to jump past a few of these kind of quickly. Railroad is sort of maybe the lowest of all the different federal agencies in terms of drug testing volume compared to, of course, Federal Motor Carrier and Pipeline. Those are the two biggest. But again, pre-employment testing required. Can't hire somebody unless they've been tested. They've produced a negative result, as you see there in the second bullet. If you go down to the fourth bullet there, background information from previous employer about prohibited substance use, required. You must acquire that information. On the right side, ODAPSI. Okay, this is the agency, the office that oversees drug and alcohol testing. So it's drug and alcohol testing and policy compliance. That's what the Office of Drug and Alcohol Policy Compliance or Program Compliance, that's what that ODAPSI means. Quote, directs employers to, quote, applicable modal regulations that might apply where testing cannot be completed. So if you're running into a situation where you are having problems getting a test done under the Railroad Administration, you can go to ODAPSI for guidance on that. If you look down at the second to last bullet, emergency waiver request flexibility is in effect. So there are some instances where ODAPSI will approve a waiver of the drug testing requirement at this particular time. There is more flexibility right now. They will, under some circumstances, issue a waiver. Now, when we get to Federal Motor Carrier, you're going to see that they've issued a FMCSA-wide waiver, and we're it was a 90-day waiver. We'll get to it and I'll explain it, but they've issued their own precise waiver language, okay? This is Federal Transit Administration. A lot of the same requirements apply. Of course, we're talking about different types of safety sensitive positions. We're not necessarily talking about truck drivers, of course, but under the FTA regulations during the pandemic, as you'll see, you must still follow the FTA testing requirements if they apply. Compliance might not be possible, they acknowledge. So follow the requirements as much as you can. Document everything if you're unable to. And I should have said that from the beginning. Documenting all the reasons why you were unable to get a DOT mandated drug test done is critical, because at some point you're going to have to account for that. You might get audited, you might not be able to meet your random numbers by the end of the year, and you need to have documented every reason why you were unable to do a mandated test. The last bullet there, examples of reasonable issues: COVID-19 related supply shortages, facility closures, state or locally imposed quarantine requirements, and other impediments that may be related to COVID-19. So under the FTA regulations, they've been very specific about COVID-19 related issues like supply shortages of maybe forms or testing materials, and the closure of facilities. Some employers are running into issues in the areas where they do business where they're not able to find a collection facility to collect a urine sample. That's not always the case. But let's review. For FTA covered employers, may a new employee or an employee returning from furlough begin work in a safety sensitive position, even if pre-employment or other testing is unavailable? When it comes to pre-employment, you must have a negative result before you can put that person back to work. If they were furloughed, well, let me get to the end of it and I'll give you the waiver language on the furlough. But we could put an asterisk right there, and I'll get to that a little bit later. PHMSA, which is the Pipeline and Hazardous Materials Safety Administration. This is important because there are a lot of companies in the oil and gas industry, or that provide services to oil and gas companies, maybe out in the oil fields, etc. And those types of tests are very important. This is a very, very safety sensitive industry among all safety sensitive industries. And so they have put out specific COVID-19 language. You see it there on the right. Operators encouraged to fully use flexibilities already afforded. So there are some flexibilities already written into all of the agency's guidelines. So they're saying go there first, look for any flexibility that may already be written into the regulations. And then, as it says in the second bullet, operators are permitted under Part 199 regulations to schedule the date, time, and location of the pre-employment drug test. That's important because you may not be able to get a pre-employment drug test done at a specific time, but you can schedule it. You can schedule the date, the time, and the location. And then in the last bullet, operators who are unable to comply with these regulations should maintain what? Documentation, okay? So that's very, very important. And as the last phrase of that paragraph says, how the non-compliance is related to COVID-19 must be in your documentation. Very, very important that you show how it would, the delay, the inability to get a test done. You have to show precisely why or how it was COVID-19 related. Now, the Coast Guard, the U.S. Coast Guard, that's 46 CFR 16. They're not actually under the DOT regulations. They were at one time, years ago. They were transferred to Homeland Security, but in essence, it's the same thing. And so many providers still provide services to Coast Guard. I won't spend a lot of time on this, but they've been very specific in their COVID-19 documentation. Again, I would say if you go, well, let's read the third bullet because that is kind of critical. So to consider, for the regulation to consider employer requests to waive pre-employment drug tests for employees that have been covered by the random drug test program for at least 60 days within the last year of the intended hiring date. That's a little bit of what we're going to talk about in a couple of slides when we talk about furloughed workers and waiver flexibility that's been issued. So you can see in the Coast Guard regulations, there has been some flexibility applied to the regulations or to the requirements, I should say, to get certain pre-employment type of tests done for workers who have been in random testing programs during their furloughed period. Now, let's get to the Federal Motor Carrier Safety Administration. I'm not going to read everything that's on these slides, but one of the things that the FMCSA has emphasized is that all the drug testing requirements of the FMCSA are still in effect. So they don't want anybody to think that you can forego random testing or you can forego pre-employment testing, because that's not the case, and they've been very clear about that. If you look at that first bullet on the right, pre-employment testing, if you're unable to conduct a pre-employment controlled substances test, so a drug test, you cannot allow a prospective employee to perform DOT safety sensitive functions. They've been very clear, they haven't changed that yet. I'm going to get to the waiver in a minute, but they haven't changed that requirement, okay? Now the second bullet, as a reminder, it is the employer's responsibility to evaluate the circumstances of what may be considered an employee's refusal to test. So under the pandemic, you may have individuals who are unwilling to go to a collection facility, to an occupational health center, etc. I'm not condoning that, but employers are running into that challenge. And so under the DOT regulations, that would typically be considered a refusal to test. Under the pandemic, there is not a lot, but there's just a little bit of flexibility when it comes to that situation. And so DOT is saying you still can't hire that person for a safety sensitive position, but you don't necessarily have to record it as a refusal to test. And there are very specific guidance on that, so be careful on that. But the pre-employment waiver is coming up here, and you see that in the last bullet, but let me get to it here. So there is the waiver that was issued on June 5th. It is a 3-month waiver in response to the economic consequences, it says, of the COVID-19 impact on the motor carrier industry. Now, go all the way down to the last full paragraph, this relief. This relief would allow employers to forego pre-employment testing for drivers who have participated in a controlled substances testing program that meets the requirements of 49 CFR Part 382 within the previous 90 days. This waiver ends September 30th. So we've still got, a month or so to go on it, a month and a half to go on it. But what it means, and this is really big, this is a big development when this came out at the beginning of June, that the Federal Motor Carrier Safety Administration was creating a waiver for a short-term period. I would not be surprised if it gets extended maybe 30 days. Don't, bet on it, but I wouldn't be surprised to hear that. It's a waiver of pre-employment testing for individuals, drivers, who have during the last 90 days been part of a drug testing program that meets the FMCSA requirements. So there could be somebody who was in a random drug testing pool during that time. There could be somebody who was maybe working somewhere else and was part of a drug testing program there that was like a DOT lookalike type of drug testing program. As long as you can show justification for waiving the pre-employment test for that individual, then you don't have to conduct the pre-employment test for that person. So you may have questions about that. Please submit them so that we can talk about that in more detail towards the end. I do want to say though that random testing is still required under the FMCSA regulations, and if you're having problems meeting the 50% requirement for drug and 10% for alcohol, you should try to make it up by the end of the year. I'm going to make another prediction that there will be some flexibility on that as well, and there's already been some stuff in writing on the flexibility towards those meeting those random rates by the end of the year. Post-accident testing still required. You must document in writing any specific reasons why the test could not be conducted. Same for reasonable suspicion testing. Return to duty testing is a little bit like a pre-employment test. This is for an individual who's been on some type of substance abuse treatment related leave of absence. They're coming back into the workplace. They've met all the SAP requirements, but they must pass a return to duty test. And what the regulations are saying and continuing to require is that that individual who's coming back from that leave of absence must pass the test before they can return to any kind of safety sensitive functions like driving a truck, for example. Okay. So recent drug testing trends that impact all of this. Well, these are the industries that that under the SAMHSA report that comes out every year, this is separate from DOT, that have showed the highest levels of substance abuse. And so you can see accommodations, food services way up there above everybody else. But these are the top 5 industries. And you're going to see some of them appearing also, excuse me, on the alcohol testing, excuse me, on the alcohol abuse numbers here too. Mining, or construction, number 3, food services industry, arts and entertainment, etc. Okay, and then these are the industries that have seen a double-digit increase in positive drug test results between 2015 and 2018. So retail at the top, and then in addition to retail, transportation, warehousing, public administration, or other services except public administration, wholesale trade, retail trade, construction again, and then waste management and remediation. Now, these aren't the positivity levels in these industries. These are the levels of increase over that four-year period, 2015, 2016, 17, and 18. So that shows you the industries that have seen the biggest increase in positive drug test results over the last 4 or 5 years. These are the industries that have had the largest number of workplace injuries related to accidents. And so you can see, this is from the National Safety Council, but you can see again, some overlapping with those 2 other categories of positive drug test results and substance abuse levels. Right in, sort of in the middle of everything, on every chart is construction, as you'll notice. And then finally, these are the marijuana increases in the increase in drug test positives related to marijuana by industry. And so the industries that are experiencing the largest increase in positive tests for marijuana are transportation and warehousing, other services, and then construction, a little higher up on this list, and it goes down to retail trade at the other end. So these are significant increases. This is not again, the level, it's not 33% across the board, it's a 33% increase, according to one major laboratory. That's a lot of people using marijuana. You may recall that in the early days of the medical marijuana movement, one of the things that we were told is that marijuana use won't go up as a result of legalizing it. Well, that hasn't proven to be true, at least not in terms of positive test results. Let's kind of, to make sure that we leave time for questions, let me just say that the importance of the policy is so critical right now. If you're doing anything during the pandemic to sort of alter your program in any way to make sure that you can still do drug testing, even though some services are harder to tap into or unavailable altogether, you need to make sure that you update your policy. And 81% of employers in this survey that was done by the National Safety Council, you can see showed that in one way or another, their policies were incomplete. And right at the top is the employee use of medical marijuana. 45% saying it's covered, 39% saying they don't cover that in their policies. Every policy we write for our clients at the Current Consulting Group contains an entire dedicated section on marijuana. And you have to do it by state because a lot of states have very specific and sometimes unique restrictions when it comes to what employers can do with marijuana positive test results. And these are the things that you take into consideration when you're writing a policy, why you're doing it, who's subject to testing, which drugs are you testing for, how are you going to do the tests. That's very important. Is it going to be hair test, urine test, oral fluid, lab-based, point of collection, etc. When the testing will occur, like pre-employment versus random versus post-accident and reasonable suspicion, what you're going to do when somebody refuses to be tested, and then the consequences for somebody who violates the policy either by testing positive or refusing to participate in the drug testing program. Under the DOT regulations, though, you must have a written policy and it must comply with the agency that you're being mandated to do drug testing. So if it's Federal Motor Carrier, for example, you're going to have a specific FMCSA policy that meets the FMCSA requirements. If it's Federal Transit, it's going to be a transit policy. It's not a one size fits all. They have very different and sometimes unique requirements in each of those agencies. And so you've got to have a written policy that complies with each specific agency that mandates you to do drug testing. And then you need to distribute it to every covered employee. And you need to make sure, as you see in that third bullet under distribute, that you obtain a signed statement certifying that the employee has received a copy of that policy. And in some circumstances, you have to actually display the policy in the workplace. These are some other things to keep in mind. I won't take a lot of time with that because I want to make sure we get to questions. These are the types of tests that you have to do under the DOT regulations. These are required under all the DOT modes. I will say for random though, it varies by agency what the frequency rate is. So earlier I mentioned a 50% random frequency rate for drug testing. It's not 50% in any other agency. It's much lower in the other agencies, but under the Federal Motor Carrier, it's 50%. And so it varies by agencies, okay? Employers may choose to require additional testing, and if you do that, then you have to have it under a separate policy that is under company authority, and you have to inform your employees that you're doing this different testing by company authority. Any kind of testing you do, any additional requirements that you may implement in your program that are beyond the DOT authority, you have to do it under your own company authority, and that's when state drug testing laws come into effect. The Federal Motor Carrier Safety Administration also requires that you have a checklist, that you include the instructions for the driver on what to do when an accident occurs. Makes sense, right? But it is a requirement. If you don't do it, an accident occurs, that could be one way in which a company runs into some financial fines from the Federal Motor Carrier Safety Administration. And then this is just the, what I'm referring to as the background check that's required under the DOT regulations. But this is an important part of how DOT keeps track of individuals who maybe have had a history of drug problems or drug test failures in the past. Under the Federal Motor Carrier Safety Administration regulations, of course, we now have the clearinghouse, which makes it mandatory for companies to report this information and for it to be updated on a regular basis. As I mentioned, that's a whole different webinar, and it would take an hour just to explain it. So we won't get into the clearinghouse requirements at this time. As I did say, though, they have been kind of turned upside down a little bit just because of the pandemic and the impact that it's had on DOT requirements. But again, a lot of good information here. I would refer you to all of this stuff as you sort of go through the slides on review. I've got a couple of slides here on the substance abuse professional requirements. That's the professional who would work with an employee who tests positive, whom you're not terminating, to help that individual get to a point where they're ready to return to the workplace again. And then, of course, the refusal to submit. That is a separate issue under the DOT regulations, but very, very important because the refusal to submit to testing under the DOT regulations is treated as the same essentially as a positive test result. And so there are certain procedures that you have to go to document that. But anyways, that's a lot of information I kind of crammed in there. I hope that I didn't confuse you in any way. But if we have any questions, Jeff, I'd be happy to entertain any of that at this time.
Fantastic. Thank you, Bill. There is definitely a lot of information there, certainly not only from what you've verbalized here in the short time that we have together, but a lot of great reference material in what you covered in some additional slides. So for those of you attending the call, the webinar this afternoon, feel free to enter your questions as you have them right now. We do have a few minutes between now and the top of the hour. We do have a question, Bill, and that is, what happens and we're in Rapid City, South Dakota, to the extent that may matter at a state level and whatnot. What happens if you use the 3-month waiver, but the employee quits after 2 months and the test is never done?
Well, one, I have been to Rapid City, South Dakota. It wasn't in the winter, thank heavens.
Oh, I apologize.
Yeah, but I've been there
The,
before.
dark-
Lovely, lovely town.
yeah,
But
we were just getting a correction on the slide. I think there must have been a typo on your slide. So Joe, thank you for that. We appreciate it. But back to the question, Bill, I apologize.
well, so here's the bottom line, and if you want a more specific response, you know, we can talk offline. But DOT has gone as far as they're going to go in terms of sort of displaying any flexibility. They're you know they've issued this waiver, and basically they're saying that if somebody was subject to testing during that 90 days before you bring them back into work, uh, subject to a DOT type of drug testing program, even if it wasn't DOT specifically, that the pre-employment exam and bringing that worker back is waived. But it doesn't actually require that they were tested during that 90-day period. They just had to be subject to or part of a drug testing program that meets the DOT requirements. So I'm not sure if that's exactly how you were asking the question, but I'm glad that you asked it because it brings up a good point, which is you don't have to prove that somebody was tested during that time. You just have to document that they were part of a testing program, they were subject to testing, they could have been tested, and that the testing program of that other employer meets the DOT requirements.
Thank you, Bill. I apologize again for that mishap and my understanding of the point that our attendee was asking. We have another question. Do you have any resources of where to find specific marijuana laws or pre-employment screens for warehouse workers?
Well, okay, so the answer to that question is twofold. One, that it depends on the state, because each of the 34 states have legalized marijuana for medicinal use, which includes the 11 states that have legalized it for recreational use, have very specific, in some cases unique, requirements or conditions, I should say, that apply to the workplace. And so they're usually not, I shouldn't put it in these absolute terms, but they're not always industry specific, but they can be occupation specific. So if you take Illinois for an example, in their marijuana law, they have carved out certain occupations, safety sensitive occupations, that are exempt from the restrictions on pre-employment testing for THC in the state of Illinois, but they're not necessarily industry specific. However, I would say that if we're talking about traditional warehousing type of occupations, there would definitely be some occupations within your warehousing company that would fall under those exemptions on a state-by-state basis. But the second part of the answer is it would depend on the state as to which of your employees might be exempt from any kind of restrictions that apply in your state. But here's the real rub when it comes to these laws, which is that they will sometimes place restrictions on either testing for THC in a pre-employment situation, or what you can do in terms of taking action based on a positive result of an employee drug test. So let's say one of your warehouse workers tests positive for marijuana. Depending on the state, there may be restrictions on what you can do with that positive result in terms of adverse employment action. So the long and short of it is it depends on the state, but your workers in a typical warehouse environment, many of them probably would be considered safety sensitive and thus be exempt from some of these restrictions. But again, it would depend on the state.
Always a lot of details, aren't there, Bill?
Oh yeah, it's really interesting. And just as an aside, had somebody yesterday, we were talking about COVID testing because we've had to become experts on COVID testing, right? Because 6 months ago, we didn't know anything about it. Nobody knew anything about it. And so I had a client say, I'm surprised that the state laws come into play when it comes to workplace COVID testing. And my response was that, the federal government is saying that workplace COVID testing is allowed, But after that, it's all up to the states. So every state has a different law pertaining to medical exams, for example. Who pays for medical exam? Well, there's 28 states that require the employer to pay for the medical exam. So if you're going to do COVID testing, you would have to require the employer to pay for that if they're requiring the COVID test. But does that mean in the other states that you can require the employee to test or the job applicant to pay for the test? We just don't know. These state laws are just so different and so detailed that the best way to answer them is on a state-by-state basis. I guess that's what I'm getting to.
So from a policy perspective, Bill, I guess I'm assuming, well, I won't assume anything. I mean, what advice do you give clients in developing policy who, in many cases, of course, have locations throughout all the states?
Yeah, that's a good question. We're in the process right now of developing a policy for a large 50-state company. I won't say the name of the company, but there's one in every state, many of them in every state. And the question from the beginning was, we're headquartered in Georgia, but we're in every state. So which law do we build our policy around? And the answer is all of them. You would build your policy for, maybe you might build the base policy on your headquarters state, but then you would have to have an addendum to the base policy for each additional state you're in, if that additional state has laws that restrict drug testing or require drug testing in a different way than your headquarters state. And so it's very unusual that we would have to develop a policy that includes 49 addendums. We've never done that before, but we have done policies for clients, 50 state employers that are maybe that include like somewhere between say 15 and 16, 17 addendums. And the marijuana situation, Jeff, has really complicated all of that, right? Because you've got some legal marijuana states that are very benign and very employer oriented in terms of protecting employers' rights. And then you have some others that are very restrictive and seem to be designed to discourage drug testing. And of course, that's not a good thing, but it depends on the state, of course, and that has to be reflected in the policy.
Well, that's as you mentioned a couple of times, the FMCSA is a webinar in and of itself, and maybe that's something we should consider doing. I think policy management, policy creation, policy attention, all those words, and probably several others, that could be a webinar in and of itself, would be my best guess.
Well, Jeff, I was just going to add that I started my company, the Current Consulting Group, 22 years ago. In September, we'll celebrate our 22nd anniversary. And in the old days, that's all we did. We just did policies. that was our core business. And I remember somebody at the time saying, "How are you going to survive just doing policies?" And 22 years later, that's what we do. I mean, in addition to a bunch of other things now, but the policy is so critical to the success of a program. And keeping companies compliant with laws, it's really the basis. It should come before any kind of drug testing actually takes place. The policy should come first.
Well, Bill, thank you. That exhausts our questions for today's webinar at this point. Thank you very much for taking the time to answer those. Thank you for the comprehensive webinar, as always, and for the additional detail. I did note there was some additional detail, and thank you to our attendee, Joe, for pointing out that we have a typo here on the current slide. We will update Rapid City to ensure that it annotates South Dakota. So thank you, everyone, for your attendance today. If you have any questions, here's the contact information on the screen. Have a wonderful afternoon and rest of your week. Bill, thank you again.